Welcome to this short tutorial for the Erector Spinae plane block, where we will review the single injection technique. This block provides hemitruncal analgesia at 3 vertebral levels above and below the injection site. It is most commonly done at the T5 to T7 levels, but can be done from the upper T-spine to the mid-L spine. The Erector Spinae plane block is fairly new and had been described in the management of chronic and acute postoperative pain. In the EM literature, case reports exist that describe its use in the management of posterior rib fractures, mechanical back pain, herpes zoster, pancreatitis, and ureteral colic. The anatomy of interest in this block can be visualized under ultrasound guidance by placing the probe in the sagittal paraspinal plane. Notice the 3 muscle layers, namely the trapezius, rhomboid, and erector spinae muscle, overlying the transverse process.
Scan with the linear or curvilinear probe in the sagittal plane to identify your landmarks. The selection of using the linear or curvilinear probe depends on the patient's body habitus and how well you can identify your landmarks. Be aware that the spinal needle might not be well visualized with the curvilinear probe. Start by identifying the spinous processes by placing the probe midline in the sagittal plane with the marker cephalad. Here you will see the spinous processes as superficial hyperechoic rounded structures with minimal musculature overlying it. Next, move about 2 centimeters laterally in either direction to visualize the transverse processes. This is depicted as a rectangular structure below the erector spinae musculature. Be sure to differentiate the transverse processes from the ribs, which are also seen further laterally as rounded structures. At higher thoracic levels, you will see 3 layers of muscle. At lower lumbar levels, you will only see the trapezius and the erector spinae muscles. How to perform the block. Have the patient sitting up straight or lying down in a lateral decubitus position with the affected rib area facing up. Place the selected probe with the marker cranially 1 or 2 vertebral spaces from the desired area. For example, if you have an 8th posterior rib fracture, target the 6th to 10th transverse process. Using a 20 gauge spinal needle, insert it in plane until you contact the proximal edge of the transverse processes as demonstrated in the images. Inject 3 to 5 milliliters of fluid to visualize hydrodissection of the muscle plane above the transverse process. Once in the desired space, continue injecting the rest of the anesthetic. Visualize the hyperechoic needle above the transverse process. Watch as the anechoic fluid hydrodissects the plane above the bone. Anesthetic selection. Depending on the block, choose the concentration of bupivacaine desired. Make sure to use weight-based dosing to not exceed the maximum dose or more than 30 milliliters of total fluid. Contraindications. The absolute contraindications are an allergy to lidocaine or infection at the site of injection. Relative contraindications are difficult anatomy, such as obesity. Possible complications are local anesthetic systemic toxicity, incomplete analgesia, injection site pain, or a pneumothorax. Make sure to have the patient on a cardiac monitor during and after the block for safety.